Joining us in studio, Greg Reed, the CEO of eHealth Ontario, and welcome to that chair.
Thank you. Glad
nice
to
to
be
have
here.
you in studio. Well, that history suggests that for almost a decade, eHealth has been synonymous with, at the very least, poor performance, and at the very worst, scandal. Is that still the case?
No, I sure hope not. eHealth Ontario was a scandal 3 years ago. My job starting April Fool's Day 2 years ago was to turn around the agency. I did that with the benefit of new board of directors. About 75% of the management team was replaced, and we began working very closely with clinicians around the province to understand what they needed, what systems they were using now, and how we could start to wire them together.
So what are you doing differently that obviously your predecessors did not figure out?
Well, I think what we recognized is that tremendous investments have been made around the province in electronic records already. The province is awash in electronic records. They are in hospitals, they are in doctors' clinics, and the problem is principally connecting them together. We have to have more doctors using electronic records so that more of our care providers have the tools they need. But this is not about building some giant database in the sky or a big government infrastructure project. This is much like building the internet. We need to connect all the points that have the information and put them into a form where clinicians can readily use them.
I have heard, though, and this was an expression somebody told me several years ago, and it stuck in my mind. And you have to be of a certain age to get the reference here, but we are building an 8-track tape player in an iPod world. That's what I've heard, that this technology that you guys are putting together is antiquated from before it's even in place. Yeah. Is that true?
No, not anymore. We rejected the idea that this needed to be a big centralized effort. What we found around the province was that in communities everywhere, clinicians had already begun to start to wire themselves together. In Hamilton, it's called Clinical Connects. It connects 28 hospitals and about 5,000 clinicians. In the Ottawa Hospital, they have a system, physician office integration in Sudbury and Thunder Bay. And we recognized what we needed to do was work with those systems, fund them, expand them, but start to move them up to a common standard of interoperability so that we could connect them together and feed more information to them than they would otherwise have. So this is not a big, giant infrastructure project. We are connecting clinicians and providing them with more information.
But this is a big thing, because I know I've talked to Eleanor Kaplan, the former health minister of Ontario in the past, who, when she was the minister and they were going to build 2 new Sudbury hospitals, and she said, you know, you guys, I don't want to interfere. The only thing I ask is that the computer systems at one place be able to talk to the computer systems at the other place. And of course, guess what? Didn't happen. Yep. How is it possible that we've got ourselves into a situation right now where we have a $47 billion healthcare system, and much of it, as we heard in the last discussion, can't talk to itself?
Yeah, that's true. You know, we have about 200 hospitals in the province, about 152 hospital corporations, and generally speaking, the information in any one of those 152 systems cannot be read in any other. We have thousands of doctors using electronic records in the province, and generally speaking, one doctor's records can't be read by another.
That's insane. How does that happen?
Well, I'm not going to speculate on what happened a long time ago, but the reality is we have a number of different systems in this province, and we're not different than other jurisdictions around the world. The key is not to try and rip them out and replace them with something better. Just about the dumbest thing we could have done would be to sit in an ivory tower and say, oh, we've had a brainwave. We're going to create a new standardized system, and all we have to do is replace all the systems that are in the province now. If you think about the internet, when Al Gore built it or whoever that was, the people who built the internet didn't go to the New York Times and the Globe and Mail and Amazon and say, first thing we have to do is change your core information systems because we want you to be able to connect with everybody else. They created a layer that enabled New York Times content, Amazon, Globe and Mail to be read by anybody using some standard systems. So that's what we're doing. We're building that layer of interconnectivity, and that's much faster and cheaper. And we can have impact much sooner by doing it that way than by trying to reinvent something.
But I gather one of the problems that your predecessors ran into, at least this was the government's line, was that Dalton McGuinty put the word out there to Alan Hudson, Sarah Kramer, your predecessors, saying, we're way behind on this. We need you to get in there and really shake things up. And they did. But the Premier then went on to say, yeah, but I didn't mean cut corners, and I don't think he said break the law, but break our procedures at the same time. Are you able to do the kind of reform you need to do while at the same time respecting what many people think are the incredible encumbrances of trying to be transparent, open, all that other kind of stuff, and follow, the government's edicts?
I think we are, and that's not to say it isn't a challenge. One of the keys has been to listen to the clinicians of the province and the hospital CIOs and the long-term care clinics. You don't learn very much listening to yourself. And what we heard was, here, this is how you can help us. The clinicians and systems in the province, they would love common standards. They would love us to take a leadership role in saying, here's how we're going to connect you together and make things better. Don't reinvent things. Connect us, and the technology for doing that has been used in banking, airlines, and the internet. There's no black art associated with it. But this is not about building records. It's about connecting clinicians so they can take better care of patients.
So let's assume when this all started 10 years ago, that represented 0. Let's assume that 10 is a fully connected system where everybody can talk to everybody. Between that 0 and 10 continuum, where do you think you are right now?
We're not at 5, but I think we're getting pretty close.
We're not even halfway there.
No, but think halfway there is a lot of work. So let me just give you a sense of where we are now. In Ontario right now, over 60% of our primary care physicians are using electronic records. Almost a third of our specialists in the communities are using electronic records. We have more doctors in Ontario using electronic health records than in all the other provinces of Canada combined. So that's a good start. We have a lot of work to do, but we've been very busy over the past 2 years. One of Mr. Drummond's recommendations was that we should put all of our lab results online and available. Well, we announced that 2 weeks ago. It's available in Ottawa now, and we're rolling out it across the hospital, or across the province. I think you've seen the ad on TV that has the person being rushed into emergency and the doctor says, drugs on screen, and they rewind and say, wouldn't it be great if when you went into emergency your drugs were on screen? Well, if you're a senior citizen in Ontario and you're rolled into any emergency room in Ontario, your drugs are on screen.
If you're a senior.
If you're a senior, and that's because the Ontario Drug Benefit Plan pays for seniors' prescriptions. We found a way of repurposing that information and
So
putting it on a viewer. And the most important thing we figured out how to do is how to connect hospitals to the communities of clinicians around them. The minister's plan for transforming healthcare involves having more people in the community and care for it in the community. As Josh Tepper said on your earlier panel, that's the key. That is powered by electronic health records. We have to move information from hospitals out to clinicians. Last month, January, we sent out 165,000 hospital reports electronically. That's 20 stories high stack of paper of electronic reports. And one of the keys there is the electronic discharge summaries, which are the key to taking care of people in the community, are included among those. So we can start to take care of people better.
I don't know this for a fact, but my hunch is that the people of Ontario expected, and I'm obviously not laying all this on your head, you just got there a couple of years ago, they expected us to be further along after having spent $4 billion to get to this stage. Is that fair to say?
You know, when you take a job like this, you decide to look one direction, and I decided to look forward. So I can talk about what's happened since April Fool's Day 2010, and we've been working very hard to wire up the province to get records into clinicians' hands and to put as much information onto the front lines as we can.
One issue we hear about, security and privacy. Yeah. How are they being addressed?
One of the features of electronic records is that you can make them secure and private. Paper records are not private records. Paper records get mailed, they get faxed, they sit on fax machines. I remember in my doctor's office, I would be inside the examination room and my entire medical history would be hanging in a file outside the examination room in a busy corridor. With electronic records, you can encrypt them, you can transmit them encrypted, store them encrypted, you can have two-factor authentication of people signing on, you can audit who's looked at their records. So we have the ability to keep electronic records much more private than we've been able to do in paper, and that's a feature we're building into what we do.
I'm not sure this issue has also been resolved, but will patients themselves be able to access their own eHealth records?
They will. The most important thing, if we're going to move the dial on quality and cost, is to get accurate health records into the hands of healthcare providers. You need to get the accurate industrial strength health records there. Once we've done that, we can create a consumer version that individuals can look at. And I think the experience around other jurisdictions across the country is they start by wiring up the providers, making those records available. I think there's only one province in Canada where there's a portal on the web where I think people in BC can look at their lab results. But across Canada, consumers can't look at their own health records right now.
I know.
But what we will have 4 pilots this year in different communities where we will be turning up different record systems and having individuals in the community look at their records, and we'll learn from that what information is valuable to them and what services.
It is, I mean, it's a strange thing that if you go to the doctor and you want to see your file, I mean, the doctor owns that file in some respects, and I know, for example, if you want to switch doctors, you got to pay your former doctor to get that file. Well, it's his file or her file.
Actually, legally, you and I own it.
Yeah, well, but practically or actually, I'm not sure it works out that way.
No, but I think in the world of electronic records, something we're going to have to something we have to manage in terms of privacy and security and consent is to enable people to own their records, to see them, but also to give them the ability to manage who looks at them and what information is shared.
How confident are you that the days of our reading negative stories about what eHealth is up to are over?
If I was completely confident, I'd be foolish. This is a complex undertaking, and it's complicated. It's going to be lots of hard work. I think we know how to do this. I think we've got a good management team, and I think actually we've developed a good track record of the past 2 years. Could we make mistakes? Sure. We're trying very hard not to, and I think the way we're working with the clinical community, I'm very optimistic about the way things are going.
Can you tell us what your budget is?
Yes, we are less than 1% of the healthcare budget in Ontario. So that's, I think, last year was about $360 million. This year will be about $400 million. That's a lot of money. But to put it in perspective, the banking industry spent about 3% of their budget for a decade in order to wire up their systems, and that's inside a single bank, so they can provide a unified view to their customers. Airlines, similar numbers. So 1% over a number of years in order to work on this transition is what it costs.
You like using that April Fool's Day line, don't you? You started on April Fool's Day 2010.
It's a way of remembering how long I've been in the job.
Very good. Well, Greg Reed, it's good of you to join us here on TVO tonight and give us the eHealth update. Thanks so much.
My pleasure, Steve. Thank you.
Support Ontario's public television. Donate at tvo.org.